So there was a study released back in, I think, 2012 that related poverty to health. And as compared to folks that are not living in poverty, those living in poverty have more depression, obesity, asthma, diabetes, and hypertension. So poverty itself is a factor that, if intervened upon, can help improve health as well. But we have to know that coming in as providers, that even though we are seeing the outcomes of this poverty, which is poor health, that we can, as providers and as a community, do things to help increase health that have nothing to do with medicine. And that is help drive policy at the state and national level to give patients who are currently living in poverty more choices, more access to care, and more access to high quality care, like the type of care delivered at this health center. Yeah, the difference between patients at the Mayo Clinic and patients at Mattapan Community Health Center are fairly stark in some respects, but also there are a lot of similarities. One of the main similarities is the fact that when patients show up here at Mattapan, or when they showed up at Mayo, they were sick and they were asking for your help. And as a provider, the feeling is about the same. You want to provide the best care possible to these patients. Then the differences sort of come in. And on one hand, at Mayo Clinic, you may be taking care of a patient who completed college, completed several degrees, had a steady job, and drove themselves to the clinic and had no problem finding parking and was able to safely walk to the clinic. That's a stark contrast to what happens at a community like Mattapan, where a patient of the same age may have had no experience of education past high school, may not have even completed high school. He or she may not have the money to afford a car to come to the clinic, so they're fairly dependent on public transportation to come in. And they may live in a community where it is not safe, actually, to walk outside at night. And part of what goes along with that, as far as I'm concerned, is their understanding of why they're sick in the first place. Someone with a very low health literacy may not understand the nuance of taking a blood pressure medication. The difficulty lies in the fact that the appointment time that I may have with that patient at Mayo is the same amount as the patient I have here at Mattapan, where I've just elucidated that it takes much more time to teach patients here about their health, because they do come in a little sicker, a little less educated on average than the average Mayo Clinic patient. And so these sorts of differences are why the health center is so important to the communities, because we understand that the patients here may need more time to understand their own disease process.